Canadian Medical Association and 14 doctors and nurses organizations want healthcare to be the top of the agenda at next month's Premier's meeting. All provinces except for Quebec have agreed in principle to a plan announced in February, which will see Ottawa provide $196 billion to the Canada Health Transfer over the next 10 years. The CMA and other groups say that's a positive step, but they point out that the healthcare system is still struggling to deal with excessive wait times, a lack of primary care, a shortage of workers, and overcrowded emergency rooms. Well, joining us now to talk more on these issues is Dr. Alika Lafontaine, president of the Canadian Medical Association. Dr. Lafontaine, welcome back to Forum Daily.
Thanks for having me back.
So, what is the current state of Canada's healthcare system after 3 years of battling the COVID-19 pandemic amid capacity issues, a shortage of workers, and so much more? Where are we at right now, Dr. Lafontaine?
So I think we're probably in a worse state actually than we were 3 years ago. For a lot of folks, we've started to get used to the reality that we're seeing rolling shortages of healthcare workers across the country. We're often having certain health services shut down. Last summer, we saw ERs shutting down across the country, including those in small towns where that was their only access. I think we'll see the same thing happening, and it'll continue to happen until we have action that affects the front line. And that's still a few months away.
An unfortunate trajectory here. Now, in terms of solutions, we mentioned that the federal government plans to invest $196 billion over 10 years to the Canada Health Transfer. However, you say money alone is not going to fix these problems. However, spending the money right might. So what does spending the money right look like?
Well, I think it really deals with two major issues. The first is the number one issue of patients, which is how do you improve access to care? And so whatever solutions get put in place, we have to make sure that we center them around people's ability to actually access services and the right types of services that they need. For healthcare providers, the number one issue is actually healthy working environments. I think we talk a lot about burnout and people's resiliency being low after years of the pandemic and increased stress. The reality is it's just not a great place to work in healthcare right now. And if we focus on access and healthy working environments, I think we do really have a chance of turning the tide with where this is going.
And in what ways is this upcoming Premier's meeting an opportunity to address these issues, particularly this major doctor shortage we're seeing across the country, and as you said, access to ERs in rural and small communities?
I think we can learn a lot from the past as we move to the future. If you look at the second largest investment in healthcare by the federal government, this was the largest this year. That investment spurred collaboration and coordination across different provinces and territories. We ended up getting the Wait Time Alliance out of that. With that Wait Time Alliance, people started to look at things like clinical pathways. And I think for a period of time between the late 2000s and 2012, people actually felt like things were getting better. I worked in the operating room as an anesthesiologist. I could actually see patients were getting easier access to care. What happened after that, and I think the reason why we're here today, everyone got up from the table and started doing things themselves again. And so I think any time that the premiers get together, it's really important to make sure that healthcare remains a focus. This is not going to be a problem that's going to go away if we just cover our eyes and quit paying attention to it. We're going to have to sit at the table and focus on some really difficult conversations moving forward.
All right, Doctor. Now, meanwhile, as we look towards what's discussed in this meeting, what are some of the next steps for the CMA and Canada's health system as a whole in terms of keeping things going forward, moving forward? Are there any strategies and plans in place right now by healthcare organizations?
So I think there is things that we'd like to see continue to scale. We had some breakthroughs this year related to regional and national licensure. Recognition of credentialing of healthcare providers has really shifted across the country. Places like Ontario and BC and elsewhere, we had the opening of the Atlantic Registry for physicians. So physicians in Atlantic Canada can move between those four provinces freely when providing locum coverage where there's shortages and there's high need. Leaning into things like team-based care, we've had a data framework that's come out with the Canada Health transfer payments. All of these things are things we need to lean into. But once again, these are complex problems that will not be solved unless we all remain sitting around the table focused. And that's our message to the premiers.
More work needs to be done. A quick 45 seconds left here, Doctor. Now, it seems that wait times and shortages are a new normal for patients using the public healthcare system. What sort of advice can you give to Canadians when it comes to dealing with all of this?
The piece of advice I'd have is that you need to shift where you're focused on receiving care in hopefully places that are less overwhelmed. So instead of going straight to the emergency room, try and get in contact with community primary care, walk-in clinics, virtual care. One of those is hopefully not overwhelmed, that's your best chance of getting care in a reasonable and timely manner. But hopefully we can fix these problems in the months and years coming ahead.
Hopefully. All right, Dr. Alika Lafontaine, thank you again for your time today on Forum Daily.
Thanks for having me.